briefly, so perhaps I'd like Susie and Janice to introduce themselves. Susie.
Sure. My name is Susie Hota. I am an infectious diseases specialist and the medical director of infection prevention and control at the University Health Network, which is a large hospital network in Toronto, and also an associate professor in the Department of Medicine at the University of Toronto.
And Janice?
I'm Janice Stein, the founding director of the School of Global Affairs and Public Policy, and a senior fellow at Massey College.
Thanks so much. So our topic of the first panel is about the management of the pandemic and possible political reckoning. The most immediate example, we had a federal election here in Canada, but there's also obviously a federal election in Germany. So I'll ask Margaret about if there was any electoral blowback about the way the pandemic was managed, if voters raised that as an issue during polling, and if there were any concern about the way the governing party handled it.
Mm-hmm. Thanks so much. Well, interestingly not, Thomas already mentioned that we rather had a lower showing of the extremist parties both on the left and the right. But I think that this election in Germany was overshadowed by longtime Chancellor Angela Merkel taking her lead, not standing after 4 election cycles. And so, in a way, COVID-19 as a disease and the way society reacted to the disease, in the way the health system reacted to the disease, was not really a topic during the election. I think that people in Germany more or less looked at how their local governments dealt with it, because that's when they had to go to, that's where they had to go to hospital, that's where their children could not go to school. And then it had a very interesting effect, because Germany has a federal government system, and so both on the local level but also on the state level, you would have a variety of coalitions, both left-leaning and conservative-leaning, and basically they all did different things in a way, and all in the context of the federal rules, of course, but it was not really easy. There's no way you could say, let's say, the conservative government of Bavaria did especially well, but the left-leaning government of Mecklenburg-Pomerania did especially bad, or something like that. So basically, people experienced it in a very personal way, but not really connecting it to political parties or political, but more or less, how did was the bureaucracy up to it? And that's where Germany did have a lot of open questions, because we do have a public health system which it was not up to task, where they used fax machines to count how many COVID how many ill people they had. So basically, we had a public health system which is not digitalized. We did have some clinics, private and public university clinics, which were really absolutely brilliant in their reaction. But basically, the digitalization issue is one that Germany now has to tackle fiercely with excellence.
Right. A large role in this debate is the public trust in institutions. In Germany, I know it's quite high. In Canada, we had a federal election that was basically had the same result as before the election. So, but I'm curious, from a Canadian perspective, looking at the provincial level, it seems like it's largely been the conservative governments that have fumbled it. We saw what happened in the United States, we see what happens in Brazil, and the Philippines, and other places. So Janice, my question for you is, how do you see the role of trust in public institutions in a political response to COVID across the world?
I think anytime there's a crisis, you get 3 very contradictory effects, Michael, and they're consistent in part with what Michael just said. When the crisis first breaks, people turn to government, and you get a government as backstory, and all of a sudden people wake up and remember they need government, despite all the years and years of being told the government is the problem, not the solution. You wake up and say, oh my goodness, my survival depends on government. Then as the crisis unfolds and it gets more complicated, and I think Susie would understand this, we were learning in real time throughout all of this, and that in a way is a wonderful thing. that our public health officials and our scientific community were learning at an incredible pace in real time, but advice changed. And that, from my perspective, that's a great thing. Paradoxically, partly because of communication styles, that led to distrust. Because how can it be that masks work or don't work within 6 months? People don't understand the processes behind that. So you get an upsurge in distrust in government that crosses political lines. And finally, and here's where I think Margaret's right. I think ahead 2 or 3 years, public attention is short. This will fade along with that, and something else will take its place. So I think the really important question is not so much how does it affect public trust in government, but what are people who hopefully will continue to pay attention to this? What do we learn? How do we actually implement what we learn? How do we hold government's feet to the fire on a whole set of issues that people inside government and outside government understand have to be done better? I'll give you just one example from our own country. The Naylor Commission wrote an absolutely brilliant report for SARS-1. It asked for a better set of recommendations. Very few are implemented. So one of the important questions to me is, why? What do we need to understand about the way our governments function, about the way we're structured, so that we can do better next time at taking what we've learned already and making sure we're not starting over. Next time we're faced with a crisis of this order of magnitude that frankly costs so many people their lives. But that's what this is, this story is lost and it's limited.
Susie, I wanted to ask you about that, about the public messaging, and I mean, flip-flopping is kind of a anathema in politics, and politicians get roasted all the time for having evolving thoughts, as Obama said, on any issue. And here we had it's called novel coronavirus for a reason. It's novel, it's new, we don't know anything about it. Initially, we thought this about services and then about airborne. What do you think public health officials could have done better in Canada or elsewhere in terms of communicating what, I mean, people don't understand science, they want to be told yes or no, and I think it's hard for people to appreciate new information.
That's exactly it. I think there are two different things. Flip-flopping of opinions, and there's also evolving science. And that's the reality. You're dealing with a pandemic. You're dealing with something that we've never experienced before, but also a novel pathogen. And some of these interventions, like masking and some of the public health restrictions, like you said, we're learning in real time. And that information cycle to implementation to decision making has really rapidly evolved to something that has to happen instantaneously. And so the public expectations have changed a little bit in terms of how quickly the science should guide a decision. And yet we have to be a little bit more thoughtful on some of them, because occasionally we'll get evidence that's really convincing and we can act right away, but there are many, many complex issues that have come to light, and they require some confirmation, they require context, they require interpretation. So, just because a new article arises that sounds really, provocative about something, it doesn't mean that you're always going to implement a change right away. So you have a variety of different, approaches that come from our evolving science. And the public just has to be aware of what's going on behind the decision making. In my opinion, if we're transparent about it, if we explain the rationale for these decisions and explain what we actually know and what we don't know about the science still, then we can help to foster more trust with the public. It's a difficult thing to do on some topics that are already polarized because of opinion. But that's where I think, having excellent communicators who are able to balance those different aspects and put it, together for the public to understand where the controversies are can help with those decisions.
I'll throw this to anybody. Do you think it's better that politicians communicate that as opposed to public health officials that might not be PR specialists?
Sorry, Margaret. No, I don't think it's so much who does it, although I think they have very different roles to play. But I think we need to understand how we talk about risk in public, right? There are ways to communicate risk, and if and what it comes down to is honesty and transparency. It doesn't matter who it's coming from. So if we can say to people, yes, there's new evidence, but it hasn't been confirmed, there's risk. There's risk in doing this, or there's risk in doing that. And we're trying to evaluate and compare the risk and give you the best advice. What I'm telling you today is what I know, but I'll be back to you next week, and my advice may change. We'll have better information, and risk evolves with knowledge, or understanding evolves with knowledge. So we didn't really hear that from some of our medical officers of health across the country. And that false assurance is the root of the problem. That's what causes the distress, frankly. So I have to underline everything Susie said. I agree wholeheartedly with her. If you have a premium who can step up to the microphone and not say, I'm led by the scientists, but say, science is evolving. We're learning. I'm learning with them. I'm listening. I'm trying to understand the risks and communicate those comparative risks to you. You bring people in the decision making that way. And there's good science around communication of risk.
And yet, I think we saw so many people bungle it. I remember the governor of Georgia, months into it, was like, "Oh, did you know that you can be asymptomatic and spread it?" And it's like, it's been months. Like, how would you, this is a leading government official communicating this. Susie, Mark, you want to follow up again?
Yeah, well, in Germany, my experience, or the way I experienced it, was that the politicians basically were all not very good at communicating it. I mean, Chancellor Merkel, she's a physicist by training, so she grasped the way that the virus is transmitted exponentially. She grasped it very fast, and so she was really quick in understanding what that would mean for society. She was very bad at communicating it to her people, basically. So the way, and maybe because it's scientifically difficult, I don't know, but the way she always emotional. And, she had this one emotional talk to the German people where she said, it's serious, take it seriously. So she stood there, take it seriously, listen, basically. And that's a very emotional, gut sort of way to connect to the people. And some said, okay, she's really emotional. What's happening here? Because they didn't know their chancellor to be such an emotional person. And then we had a huge slate of experts, basically virologists and people like that, who went on public TV, who went on talk shows. And some were better than others in explaining things. But in how I experienced the whole thing, what really worked for basically everybody in Germany was that when a young female journalist who was also a trained chemist, and she did a YouTube program, and she's dramatically popular on YouTube in explaining scientific things, jargon. And so she started to take on that, and she was an instant click machine. Like she had like 10 million Germans click on her YouTube video. So I'm fairly certain that she was the person where a lot of Germans got a real good information. And the program didn't run a minute, it ran a whole hour on YouTube, and people watched it. And so the German media system did a really good thing because they put her on Prime TV. And now she has a Prime TV channel thing where she's trying to explain these things. So what do I take from it? I take from it that the people responsible do have to look for good communicators. Good communicators. And that might be not the politicians, because they're trained in other things. It also might not be the scientists, because they also train in other things. If there are scientists who can communicate well, wonderful. But if you have somebody trained in communication who is also trained in science, like this young lady, this young scientist, this young scientist and journalist, that's the perfect way to go. That's what I would advise, basically.
politicians here. I mean, I remember Brian Pallister in Manitoba, who had been kind of arguably mishandling it from the beginning, and then there was a point, I think around Christmas or something, and then he suddenly got very emotional, almost on the verge of tears, and then I think that might have shifted the narrative in Manitoba, where there's somebody who was kind of, very business-like, and we can't do that because it'll affect business, and then suddenly he was like, people are going to die.
Interesting. That's like Merkel did in Germany. Oh,
Yeah, but I can't see Jason Kenney or Ron DeSantis doing that, like in terms of like backtracking on hard lines that you're taking.
I think the emotion can be very powerful if it's really genuine, and people can see through that, quite easily. So it can be a powerful tool. To come back to your question about who should be communicating some of these things, I truly believe it should be a collaborative thing. I think it's important for the politicians to be up there to communicate some of the decisions, because in the future you have to look to your politicians as leaders who are going to make some of these important decisions, and many of them will transcend beyond sort of the science and the pandemic itself, but have much broader implications. And that's where, if you only had sort of a content expert speaking on what's going on, you can lose some of those other, consequences that arise from what seems like an obvious scientific, decision that needs to be made, and you can really kind of miss the big picture. But having somebody at the side who is truly able to speak on the science, the content, the background of what's happening with the virus is also really, really important. And in an ideal world, you'd have them side by side speaking the same language to everybody.
There was a poll, Elections Canada ran it recently about, it was a faith in institutions type poll about our own electoral process, but they also asked about, do you have faith in the federal government in general? I think it was an apolitical question. It wasn't about the show. Federal government bureaucracy, provincial government bureaucracy. And the story I read was trying to paint it as, it's positive. 55% have confidence in the federal provincial government. Like, that's not great. And then they also mentioned that 40% believe in conspiracy theories. Now, there's a lot of questions with polling and how do you define what question is actually being asked there, but I found those numbers quite interesting. Again, do we have trust in government to communicate these things to us? And again, that circles back to who best can communicate these things, especially when institutions of government have been so devalued.
Michael, just to again reinforce. Sorry, Susie, I'm an echo here, but to reinforce what you just said, our elected leaders are accountable for the decisions they make, and we vote, most of us, and if we don't like what they're doing, we throw them out. So you can have the best science in the world, but nobody elected the scientists. And so the goal for really great scientists is to communicate to the public, but to join with the politicians together in a shared enterprise. And there are very few duos that got that right, but when they get it right, it's really magic. So I think it's very important not to diminish the expectations we have of our political leaders. They will never understand the science that the scientist does, but there can be an explicit collaboration. You're going to get a different discussion of risk from a trained scientist than you are from a political leader. But political leaders, that's what they do. They have the capacity the good ones, they have the capacity to communicate and really help the public understand really difficult things. Whether we're talking about the pandemic or we're talking about climate change, it doesn't matter. So I don't want to let our political leaders off the hook here and download this responsibility onto scientists and public health officials. I think that's a serious democratic mistake. Let me put it that way. If I have 1 minute, just to raise a second issue, which Germany and Canada share in common, I think, is the absolutely primitive capacity to share data, to share in real time. I just don't want to miss that opportunity. It is a huge problem in our country. I will just say that at the beginning of the pandemic, we had Health Canada officials uploading data by hand. Now, that's not something that we think about when we think about ourselves. It makes Susie's work a nightmare, frankly, just a nightmare. And Germany, which is one of the most advanced high-end value manufacturers, is not where it should be in developing digital health systems, right? And ultimately, what we learn from all of this and what we're going to make useful is going to depend on the quality of the data and the evidence that we have. And I think both countries have a hill to climb on this coming out of this experience.
On some of that, so when you talked about boxes, we too have the facts problem. So a lot of our data that we have to submit to public health has to go via facts. And in the early stages of the pandemic, I ended up seconded research staff public data entry because it was just such a volume of manual, like just mind-numbing data entry that had to happen and get faxed over. And so, I mean, these are some of the things that kind of paralyze you. And even the fact that some of our public health colleagues that we communicate with and we need to go through very complex cases with don't have secure email that we can actually share more sensitive information with. I think that this is not the way that you can actually build a strong public health system, and we need to work on that for sure.
But there's interesting problem with basically democracy and how we run our countries, because in Germany, the base of this problem is that we are a federal state, and that our states are basically independent, and that the communities and the cities are again independent. So basically, the German chancellor, whoever she or he might be, has no way of telling the public health official in Cologne or in Munich or in Hamburg that they should update their systems to system ABC and throw the fax machine. She just can't do it, or he can't do it. And so just by being a federal state, which has enormous amount of advantages, this is definitely a disadvantage, that you can't roll through, that you have to go through, the states is different, and Cologne has a different system than Munich, than Hamburg, than Berlin, and you're not compatible. So what do you do? And it's a really interesting question for how we run our states, how we organize our society. Do we want to keep federalism in that aspect, or do we say now, with what we learned through the pandemic, we have to find ways to sort of overrule the federalism in cases of emergency, because that's what we saw. We were slowed down tremendously by that problem you just told us. And should that be the chancellor who could say, stop, we do have an emergency, people are dying, we do have to cut through federalism, and I have to say, each public health official in Germany has to throw the fax machine, has to do a 20-hour crash course and learn how to do the system. And then two weeks later, you're all set.
One of the main criticisms of the federal government here was that it was not coordinated. Like, if this is not a national emergency, what is? And is it not time to take federal? I believe we're going to move to a question. Yes, from the audience or from online. Oh, does anyone in the audience have a question? Do they want to throw our does anybody online? There is one on the chat. Am I going to see it on the screen?
So the question is related to what Janice also mentioned. How do we address the issue of data sharing? Is that a result of provinces being in charge of healthcare? So it goes back to what Janice mentioned before.
Susie, maybe you?
Oh, goodness. I don't think I can solve this, but yeah, I mean, it's definitely a problem. And with different systems in place, it means there's delays in getting information, and you're not always comparing apples with apples. And so, again, it comes down to the importance of having expertise to give the context. So I can say, this is what's happening in this province, this is what's happening in our province, but here are the caveats around how to interpret that. So again, I think that Yeah, I agree. If ever there was a time or an incentive to have a national kind of way of dealing with the data and the surveillance that we're doing, it's now. And I will say from an infection prevention and control perspective, so I deal with healthcare associated infections, it would not be difficult to have standard definitions and a standard system for collecting the data on what's happening with healthcare associated infections. Yet even today, we don't have a fulsome national surveillance system that's up even today.
You know, I want to echo again, and I'm going to be blunt. This is 10th grade performance, right? This is not rocket science. It's simply a lack of urgency around building a national data system. Yes, there's divergence of a millimeter about what a particular infectious disease the indicators are, but those are solvable problems. You know, the Prime Minister and the Minister of Health have to convene the ministers of health across this province, take them away for 2 weeks with their senior civil servants, isolate them, and say out of this comes a national data system with shared definitions and shared indicators. Because if Quebec doesn't know what Ontario's doing, and I ran a project with some colleagues where the most valuable thing we did, we built a common data system, Susie, and out of that data system, because the people who were using it were uploading, we could tell Quebec what was happening in Ontario and tell British Columbia what was happening in Ontario and Quebec. They didn't know. And as soon as we told them to share the data, their guidance evolved. And then we'd come back and say to them, first of all, do you know guidance has changed in British Columbia and it hasn't yet changed? There's no knowledge sharing. You know, I hate to say this, but this is why the digital companies are where they are. Because there's a nimbleness and a flexibility with all the risks that they present to society. They make it happen. We can't. As a Canadian, I will just say this is not good enough, and we should not accept it any longer. It's not okay that for 10 years we've worked on building a national data system, and it wasn't in place when we needed it. We're wasting our scientists, frankly, if this continues. And my last point, we should destroy all fax machines.
That's a
Yeah,
big
we can
takeaway.
agree on that.
We should. And well, you know why we have fax machines? Because it protects privacy. Now, how nonsensical is this, right?
Suddenly hands went up, but we have a timer now. We're taking a question? Yes. From my esteemed colleague here.
Hi there. This is following up on Janice's comment about how we have short memories. And, considering that we've forgotten enough of the lessons and the recommendations from SARS 1, how do we push to hold politicians' feet to the fire after this pandemic for something that we don't know when it will come, and how it will unfold for the future?
Anyone?
Great question. And I will say, as much as we like to put this experience behind us and never think about a pandemic again, pandemics are independent events and another one can happen tomorrow. I was very disappointed, as Janice had mentioned, that there are several commissions that came out of SARS and we haven't implemented many of those recommendations. And we're already partway through this pandemic, I won't say halfway, but partway through this pandemic, and we've got a long-term care commission here in Ontario that, I'm very hopeful we will actually enact some of those changes. But, I think I don't know how we light the fire under the feet. It's a bit of a disappointment that we put all this effort into trying to investigate and understand the root causes behind some of the crises that have occurred and some of the terrible things that have happened through this. I think that should be something that we hold people to as we make decisions at election days. That's really what it has to be. I don't know if there are other opinions as well.
Coming to Europe or Germany in specifically, I do think that that it is filtering in people's decision when they go and vote, and it's just basically to the special election this time with Angela Merkel not standing anymore, that sort of been the main issue. But would that not have been the case, people would have voted according to how votes have been in on their level. And so we will probably see it at the state level. We had, for example, we had a couple of state elections also, and there was one in the north of Germany, Mecklenburg-Pomerania, and it seems like they voted for the prime minister they have. And when you ask the people there, one answer they gave you was that they felt secure in how she handled the pandemic. She had, because she closed her state down much earlier than others, and it's a tourist region, so the rest of Germany was really appalled because you couldn't go there anymore, even if you had a vacation home, and it's your own vacation home, and so you were going to Berlin to the Baltic coast for your vacation. You couldn't go there because this prime minister shut everything down, and she erected barriers, put out her police and they control, and he said, "It's my home, it's 50 miles. Why can't I go?" And she said, "No, it's pandemic." So
Like the Atlantic bubble here.
So there was reaction, and she did profit from that because she really had a sound victory in the election. So I think people do hold the politicians accountable. And what I also see in Europe, because we had so many different elections, like in France, a totally different situation, like in Italy, for example. What you do see is the European Union, as much as you can criticize from the way they bought the vaccines and how slowly they were in buying this compared to like the United States of America, and I don't know about Canada. But what we did was really helpful is that we can learn from each other's experiences, and optimally we can sort of put together a best case scenario with what did go well in Europe and in which country, and how can we implement that into the European procedures. That would be my hope.
So if I could add, Michael, just really quickly to the answer, I don't think it's going to be enough just to say we're going to hold politicians accountable. Both countries have federal systems where we divide authority, and provincial and health is, as we know, provincial jurisdiction. And that's part of what's wrong. It's so fractured that when we face an emergency, it imperils the functioning of the system. I frankly believe we need a citizen panel coming out of this with some of our top public health science and our scientists and some citizens on it too, that set out an agenda for when we need an integrated national data system. And we set deadlines, and we partner with a newspaper, and every 6 months we audit and we say, where are you? And it's literally is, I think, an experience like this says, this is bigger than government. We need you to do it. This is bigger than government, and we want an accountability metric, and that's really hard for governments to resist. So, instead, I said to David Naylor, what we need coming out of this one is not another set of recommendations, but a process to make sure that those excellent recommendations are absolutely implemented, and an audit is done.
So we need accountability, we can blame federalism, right? We can agree on that. Our time is up for this panel. I'm sure many other questions will bleed into the other topics here today. I want to thank our panelists, Janice, Susie, and Margaret, for being with us today. Please round of applause. In the audience, while we do a quick changeover, there is going to be a few questions we're going to ask people online to poll, and people here, there's QR codes, I believe, on your seats. You can do this. And this question will be addressed to the next panelists. The question is, how much of a societal disruption is the COVID-19 pandemic for you? None at all. Very curious to see how many people say that. minor, moderate, severe, or actually apocalyptic. So if it's really bleak today, you can check. So I invite you to fill out that form while we're changing over. My colleague Rebecca Pollard will be hosting the next panel. Thank you very much again. We'll just be about 2 minutes.